The log roll, how to get in and out of bed safely. In this video, you'll learn why the log roll method is used, how to use the log roll method. Why is the log roll method used? The log roll method helps you get in and out of bed safely with less strain to your back and belly areas. Your care team may recommend using the log roll method if you had surgery, have back pain or injury, have fragile bones. How to use the log roll method. To lie down, sit at the edge of your bed. Keep the center part of your upper body straight. Think about lowering it without twisting. Use your arms to slowly and gently lower yourself onto your side as you lower your upper body and raise your legs. Lie on your side. When ready, and if you'd like, you can roll onto your back without twisting. Straighten both legs and lie flat. If you need to move a little, gently lift your hips to move your body slowly. To get out of bed, do the same steps in reverse. Bend your knees so your feet are flat on the bed. Without twisting your body, lie on your side facing the direction you want to get out of bed. Use your arms to help raise your upper body as you lower your legs over the side of the bed. Keep your upper body straight as you move. Sit up straight on the side of the bed. If you feel dizzy after sitting up, wait a minute or two until you feel steady. When you're ready, place your hands on the bed and use them to help push yourself up to a standing position. If you have any questions, please contact your care team. They are here to support you. For more patient education videos, visit us at fredhutch.org/patient-education-videos.